Yo, what's up, guys? So today we're going to be talking about pharmacology optimization for lifestyle bodybuilders. Okay, so we're focusing on the lifestyle aspect of how PEDs can be used. Okay, I'm not saying there aren't a utility for bodybuilders. I'm a bodybuilder myself, but I understand the applications and I help people get to where they want to get, whether it's bodybuilder maxing or lifestyle maxing. But today we're focused on lifestyle maxing. Why? Because most people don't want to become a bald ogre. Okay, most people want to just look good, feel confident, be lean, jacked, and shredded. Okay, so let's actually take a look at these. Okay, so lifestyle maximization. It means that you're not a bloated ogre. You actually keep your hair so you don't fucking look like an old aged incel. Right? You have tan coloring, and the main thing is you're lean and aesthetic. Okay. That's the Bali sort of archetype, right? This is what most guys want. This is what most women want. And this is what will realistically benefit your life the most in terms of holistic self-improvement. And the antithesis of that is bodybuilder maximization. So this guy here, you've probably seen him on TikTok. He's bloated, he's bald, and he's quite literally just a 250-pound ogre, okay? So the thing you have to understand about is these guys are very fucking antisocial gym cells, okay? They don't look good. They don't have any female appeal or lifestyle appeal for that matter. And I'm not hating on it. I'm just calling it for a spade. You know, I'm an antisocial gym cell myself, but I understand the benefits of lifestyle maximization. And when I get lean, you know, I achieve this. And I would not take the PDs as far to become like this because you're just going to look like shit, okay? Being jacked is nice, but if you don't keep your hair, you don't keep your appeal, I think it's kind of redundant because, you know, you might see this male gaze wise and think, oh, this guy's like a really jacked, you know, whatever. That's amazing. But if your goal is to improve your dating life, then this is something that you need to avoid. Okay. I'm not saying there's anything wrong with this. Okay. I'm not judgmental at all. I'm just calling a spade here. Okay. So don't take this as me hating on fucking big gym guys. I think it's amazing. I think they're pushing the limits. I'm just saying for application purposes, if you want to maximize your lifestyle, this is not what you want to go for. Okay. So how do we actually achieve this? So let's look at the four main buckets of how these sort of physiques are built in terms of lifestyle maxing. So one is obviously hormone optimization. Yes, you're going to be using PEDs. All these guys are fake natties. They use PEDs. Okay, they just won't tell you about it because they like to gatekeep. They want to keep you a skinny fat chud that struggles to get lean, right? And stays natty or stay ascend and fuck all your women. Okay, and the next is training, nutrition, and recovery. These are probably the biggest moving components. So these cannot be skipped. Drugs are purely a tool. Okay. Now let's actually talk about the compound selection. What are we actually using here to achieve these results? So first, you're going to need a base or main anabolic. And this is either going to be testosterone enanthate or testosterone cypionate. One of these esters, they both work, but just choose one. I like enanthate, and I think most people will like enanthate, but you want a longer/moderate ester so you get the stable blood levels. You know, don't do the probe or the test blends like sustanon. These are completely useless, and the volatility is much higher with these short-acting esters, okay? As far as ancillary compounds, we're looking at anavar or masteron. So these are DHT derivatives. And when do we want to use this? You want to use either anavar or masteron once you finish like a full cutting phase and you're ready to like really peel out, because what these will do is they'll dry you out. They actually help you dry out via increasing the androgenic load and whilst keeping the estrogenic load lower. And so when you have that ratio skewed towards more androgenic properties, or I guess you could say amount, for lack of a better word, you're going to dry out more because estrogen is what holds water and keeps you bloated. And so when you have less estrogen in comparison to your androgen levels, you're going to dry out, and that's how the bodybuilders, you know, get prepped up for a show. So if you've done like a full, say, 12 to 16 week cut, the last 6 weeks you can throw in an anavar or masteron, and that's going to help you dry out, and you can go to the beach parties and all that stuff and look like sick cunts, like Aziz, bruh. Also, you're going to need retatrutide and MT2. So if you want to do proper coloring, MT2 is amazing. The cancer, fear-mongering is all bullshit. It's not going to give you cancer. It's more to do with sun exposure causing the cancer than the actual MT2 itself. And retatrutide is a fantastic way to curb your hunger, curb your cravings, and actually help you get lean to lean out. Now, let's talk about the truth about, you know, achieving this sort of physique here. Okay, there are phases to when it comes to this. You don't just go from A to B to this. There are a few phases. So typically, anyone with a substantial amount of muscle mass will have bulked for an extended period of time. I mean, you can see in this photo here, These Bali guys, they were once fat chuds, but you can see there's good amount of muscle mass everywhere. And that's because they bulked, right? This is like necessary part. Now, you don't have to do it this way. You can lean bulk. And for some people, lean bulking can work because they just have such a high metabolism that, they can literally gain the muscle without any fat. But for most people, even on roids, you want to be in a controlled surplus for, 6 months to even 9 months to really put on that muscle. Then you can cut and then you can maintain. And once you maintain, you can literally keep this sort of look for the rest of your life on TRT. And you're good, you're set. So yeah, you're not meant to look pretty all the time, okay? It's like being a fucking worm in a cocoon before you ascend into a butterfly. There's beauty in the pain, and, it takes pain and it takes being chopped fucking fat ass. Not too fat, you don't want to be too fat, to sort of ascend and actually build muscle optimally, okay? If you do decide to stay lean year round, it's going to be harder to put on tissue. It's going to be harder to improve your performance. So it's about doing a controlled surplus, 200, 300 calories over an extended period of time, throwing in mini cuts when you can and when you need to, and just holding that and really focusing on performance and not the cosmetic look. So if you want results like this for yourself, these are some of my client results, okay? So we have Kaylin, Freddie, Jazz, and Nathan, okay? All these guys came to me, right? These are what they looked like before, whether they start off fat or they start off skinny fat or just skinny. In less than typically 6 months, we were able to create these transformations. How? Well, we optimized their hormones. And on top of that, we optimized the training and the nutrition. I think a lot of you guys need to hear this truth, but the gear / pharmacology side of things is, yes, it's necessary. You're going to need it, right? But it's only 10 to 15% of the equation. If your training is not locked in and your diet is not locked in, you're not going to look good, like, at all, okay? The gear cannot compensate for that. Like, the training stimulus is what actually drives the muscle growth. The gear just amplifies that. And so you need the whole package to actually ascend. Because, the truth is, a lot of these guys that ask me, oh, what cycle? It's like, and I look at their physiques and I'm like, dude, no cycle is going to help you. I'm like, how do you think your training's going? Is it all right? And they're like, oh, like, yeah, it's really good. I'm like, clearly it's not good. If you're looking like that for the past 2 years, you don't know how to train. Maybe you should be less ignorant and actually learn from someone that's had, over half a decade of experience in this game, okay? Like myself. So this is my transformation here. Started off skinny Asian guy, right? Was sick and tired of the fake natties lying to me. Once I started optimizing my hormones, I was able to create this transformation, build way more muscle, get tan, be lean, and aesthetic, okay? This was like my dream physique. And I'm still getting bigger. I'm still improving, all right? And so ultimately, as a man, you have a choice. You can either choose to stay average like everyone else. Everyone else loves to be average. They don't want to put in the work. They want to look like shit, okay? That's one type of person. Or you can choose to become the best version of yourself. That's what I believe in. That's what I'm doing. That's what I will spend the rest of my life doing and helping my clients achieve the same thing, okay? And so if you're sick and tired of looking like shit, you're training hard, but you don't even look like you lift, yeah? And you're sick and tired of being lied to by fake natty fitness influencers. So all these guys that you see and look up to, they're probably on gear. And guess what? They don't tell you their cycles. They don't tell you what they use. And they don't tell you how to do it because they don't want you to ascend. But I'm not like them. I'm ascending every motherfucker that works with me, okay? You are genuinely committed and you want to build your dream physique. I only work with committed people. If you're half-ass, don't fucking message me, okay? Because if you're half-ass, you're not going to make the transformation. You don't want it bad enough. I only work with people that actually want to fucking ascend, okay? And you want real guidance. You want a clearly mapped out system that can guarantee results whilst doing so safely, right? I make sure all my clients are safe. We do all the blood work, the biomarkers, everything, right? And if this is you, you can book a one-on-one strategy call with me. The link will be in the description. We'll basically talk about what your exact goals are and how I may potentially help you and see if you're a right fit for the program. So yeah, that's pretty much it for the video, guys. And peace out.